Hi, my name is Khalid Sharif. I'm a consultant orthopedic surgeon with an interest in sports surgery, and today I am doing the video from the very gym that I and some of my athletes train, because I want to demonstrate some of the exercises required for this next injury, which is Achilles tendonitis. I'm going to be speaking about the anatomy, who gets it, what's the differential diagnosis, the signs and symptoms, how to diagnose it, and how to treat it. Please, if you do like the video, give it a thumbs up, subscribe to my channel, and let me know in the comments if there are any further injuries you want me to address. So let's dive in. The Achilles tendon is the tendon that connects the muscles of the calf, the soleus and the gastrocnemius to the calcaneum. It is important for lifting you up on tiptoe. It's also important for walking and for running. Who gets it is mainly athletes like dancers, jumpers, runners, dancers, but also people with flat feet, obese people, people with inflammatory conditions like rheumatoid arthritis, people who wear a lot of high heels would get it. The symptoms are you would get pain at the back of the ankle with local tenderness, local swelling, stiffness. The pain usually in the early morning, but it increases with activity, it increases with a tiptoeing stance, and you will get local tenderness, and it is diagnosed with a scan like an MRI or an ultrasound scan. Now, it's important to realize that not every pain at the back of the ankle is due to Achilles tendonitis. You can get rupture, which can be complete or partial, but here the presentation is much more acute. You won't be able to stand on tiptoe at all with a complete rupture, and there will be a gap. With the partial rupture, there will be a thinning with local tenderness at the Achilles tendon. Retrocalcaneal bursitis, this is pain around the Achilles tendon, in front of it and either side of it. It's different in presentation. The other one is tarsal tunnel syndrome. Here it's pressure on the tibial nerve as it traverses the ankle, and you will get numbness and tingling with the symptoms of pain. Tibialis posterior tendinitis, this is in a different area here at the back of the medial malleolus, which is the bone on the inside of the ankle. These people, this happens usually in flat-footed people, and then also you would get pain with tiptoeing. Haglund's deformity, this is due to a growth at the back of the calcaneum, and this can press on the Achilles tendon, and that's diagnosed with an X-ray. Now, the treatment for this condition in the acute phase is rest, ice, non-steroidal anti-inflammatories, ultrasound scan, and some exercises with massage. In the chronic phases, then injections work, steroids, but you have to be careful because that can cause a rupture of the tendon. PRP injections, and I'm going to make a whole new video on the uses of PRP in sports medicine. You can do extracorporeal shockwave therapy, and physiotherapy would work in both the chronic and the acute, and it's mainly, I will demonstrate the heel drop exercise, the way to massage the tendon, and rolling it on a foam roller. Last but not least is surgery, and here we incise the tendon, we remove any scar tissue and any damaged tendon tissue, and decompress the tendon, and usually they require rehabilitation afterwards. I hope this is helpful.